To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hi, and welcome to Your Health. Today we're joined by Dr. Kevin Campbell from OSI. Now we're talking about your innovative approach to knee replacement surgery. Tell us a little more about what you do.
Yeah, thank you very much for having me.
Of course.
Knee replacement traditionally is something that surgeons have to cut tendons and muscles around the knee to get down to the knee and do the surgery.
Sure.
Traditionally, that's cutting the quadriceps tendon, flipping the kneecap to the side, and then doing the surgery before repairing it at the end. The approach that we take helps patients recover quicker, have less pain. So we avoid cutting the tendon. We work underneath that muscle, bring it to the side, do the surgery, and then the normal anatomy kind of falls naturally back in place, and patients can recover quicker with less pain.
I think you just went over any patient with recover quicker and less pain, right?
Yeah.
I mean, those are huge benefits because I think anytime you're talking surgery, that's a little scary, let alone joint replacement surgery.
Right.
So tell us more details of just like kind of the reaction that you've gotten from some patients that have gone through all of this.
Yeah, I've seen patients recover from both the traditional knee replacement as well as this kind of quad sparing, minimally invasive surgery, and I'm really happy with how our patients are doing. Traditionally, a surgery that causes a lot of pain is much more comfortable for them. They're able to recover quick at home by themselves with family support, and I think it allows them to get back to their activities quicker. So what used to be something that was very daunting or intimidating has become a much more approachable surgery and recovery.
Gotcha. Now, as far as like recovery time from like a traditional way of doing knee replacement surgery versus your innovative way of doing this, what is kind of the timeline of that?
Yeah, sometimes with the traditional knee replacement, you're having patients take 2 or 3 weeks to be able to get their legs strong enough to get in and out of bed, those sorts of things. With the subvastus approach, the quad sparing approach, we're seeing patients do that on the day of surgery within the first couple of days.
Wow.
And it just seems to be a more comfortable way to recover.
That's incredible. 2 weeks to like the day of or the day after, that's absolutely incredible.
Yeah, it's been very helpful to be able to offer that type of surgery to my patients, and it's something that if anyone's interested in moving forward with that type of surgery, I'd definitely try to learn more about it.
Absolutely. So if you do need knee replacements, definitely something to look into. Less pain, quicker recovery, great information, and thank you for watching To Your Health.